College students headed back to campus this fall will have familiar guidance about COVID and new warnings about monkeypox. The CDC has recorded nearly 17,000 monkeypox cases nationwide. White House officials spoke with university leaders yesterday about this outbreak. Meg Oliver looks at the ways colleges are preparing for yet another public health emergency.
Hofstra University in Hempstead, New York is prepared for monkeypox if it arrives here in the fall.
Our team has practiced this, we're ready for this, and this is what we do every day.
Executive Director of Student Health Services, Rob Stahl, says they've ramped up cleaning and disinfectant protocols to help stop the spread.
The good news is that monkeypox is not like COVID in that it is not as easily spread. It is not spread through small droplets. It really requires much more prolonged contact.
Of the some 17,000 cases nationwide, New York has the most of any other state, followed by California, Florida, and Texas.
How are you educating students?
So we have posters up in all the bathrooms on campus, as well as common spaces on campus that students are in and would access, and also providing them information about health and infectious disease in general and how they can best prevent themselves from getting sick while they're here at college.
That also includes having testing in place for students who might show symptoms like fever and a characteristic rash.
Monkeypox is primarily spread by close contact with individuals. That's skin to mouth type of contact.
Amish Adulja is an infectious disease physician and senior scholar at Johns Hopkins Bloomberg School of Public Health. He says schools like Hofstra are doing the right thing by making sure infected students have somewhere to stay for a while.
They need to make sure that they have ways for students to isolate in a comfortable manner for a couple of weeks if necessary.
Is that feasible for most universities to isolate students for up to 2 weeks?
What we know is that universities really had to reconfigure their operations because of COVID-19, and they always had isolation dorms and isolation rooms.
But overall, Adulja says the risk for universities is low.
I don't necessarily think this is going to be a disruptive force on college campuses, but it is something that colleges need to proactively plan for so it isn't disruptive.
We reached out to more than 30 schools for this story, and while many were making some kind of preparation, mostly sending informational emails to students, none expressed that monkeypox was as dire a concern as the COVID-19 pandemic. Jamie?
That's good. I hope they have plans in place. Meg, thank you.